So the reality is there's a hidden force that's at play right now, and it's undermining both the health and the happiness of people that live in industrialized countries. Um, this force basically involves the stimulation of dopamine in our brains, and dopamine is the neurochemical associated with pleasure. So when dopamine is artificially stimulated, for example, in the case of drug addiction, people will use drugs to induce pleasure, but they'll have to keep using those drugs in order to avoid very uncomfortable problem with withdrawal. Kind of the hallmark of addiction is that you're using something both to induce pleasure, but then you have to keep using it to avoid real pain. And the way that it works essentially is pretty straightforward. You take chemicals, whether they be cocaine or methamphetamines, alcohol, nicotine, caffeine, etc. It stimulates the brain. The brain secretes dopamine. The dopamine induces pleasure. And it makes sense because the brain was designed to get the body to engage in behaviors that favor survival and reproduction. The problem is that brain evolved in an environment of scarcity. It didn't evolve in the environment that we're living in today. And as a consequence, we can get fooled. In fact, there are, for example, chemicals besides drugs that can also stimulate dopamine in the brain that you can actually put into food or into feed. Those chemicals include salt, oil, and sugar. Salt, oil, and sugar are not food. They're hyperconcentrated food byproducts that are added to food to stimulate dopamine production, induce a pleasurable response. And the problem with putting those chemicals in our feed is they can stimulate overfeeding. If you, for example, you put the chemicals in rodent food, they'll gain 49% of their body weight in 60 days. If you put it in the feed of birds, the birds will get so fat they can't even fly. And if you put it in the feed of humans, the humans will become overweight. And that's, in fact, why we see the obesity that we do. The salt, oil, and sugar that are put into hyperconcentrated foods make those foods significantly higher in caloric density, and as a consequence, significantly more tasty. Because, again, taste is essentially how much dopamine is secreted in the brain when the food is put in your mouth. So if you're putting hyperconcentrated foods in the mouths of humans, their brains will be highly appreciative of those foods. And then if you try to put lower caloric density in the mouths of humans, they will respond appropriately. The consequence of putting salt, oil, and sugar in the feed of humans is that 72% of people living in industrialized countries are now overweight or obese. And being overweight is not just a cosmetic issue. The fact is that when we put hyperconcentrated foods into our diet and we become obese, we're gaining fat and we're gaining visceral fat. And as we'll discuss, visceral fat essentially functions like a tumor and can be extremely detrimental in terms of our health. Once an animal or a human is caught in the pleasure trap, it's extremely difficult to get out. For example, if you're an alcoholic and you go to a inpatient program, and then you go to a 12-step program for 90 days, and you have family support, you have about an 18% chance of being successful at not drinking for a year. That means 82% of all patients will fail. If you're addicted to heroin and you go through inpatient program, you have about a 10% chance of being able to not use heroin for a year, which means that 90% of people will fail. And if you're overweight and you want to lose even a modest amount of weight, say 5% of your body weight, and sustain that 5% for 1 year, 95% will fail. The reality is you have a better chance of quitting heroin than you do losing weight and keeping it off, at least using conventional approaches. What's even more startling is if you are an individual with a BMI over 40, the chance, if you're a male, of getting down to a healthy weight and staying there is 1 in 1,290. And if you're a female, it's 1 in 667. Essentially, you have a 99.99% likelihood of failure if you're starting off with a BMI over 40 and want to lose down to a healthy weight and sustain it. And the problem with this, as I said, is this fat that you're gaining, and particularly the visceral fat, that fat that accumulates around your organs and in the belly, produces inflammatory markers. It's involved with deranged metabolic function, cardiovascular disease, high blood pressure, autoimmune diseases, type 2 diabetes, cancer. Visceral fat is hypertrophic, hyperplastic, and hypermetabolic. And as I said, you think of it like having a big tumor. If somebody said you had a multi-pound tumor in your body, it wouldn't surprise you that it would be associated with production of inflammatory products and health compromising products. But visceral fat obviously can't be easily excised like you would a tumor. Looking at it another way, if you say what percentage of American adults exhibit the 4 fundamental healthy lifestyle characteristics? So being active, not smoking, eating a, quote, healthy diet, and this was a very broad definition of healthy diet, and having the recommended body fat percentage, that is, if you're a male, being under 20% body fat, and if you're female, being under 25% body fat. So what percentage of Americans have those 4 basic health characteristics? You might be surprised to find out it's 2.7%. So 97.3% don't even meet those 4 most basic requirements. If you look at the obesity charts, you find that obesity continues to spread. We keep having to add new colors. You can see that the people at the CDC are true optimists, because even though no state has yet been able to break the 45% obesity saturation rate and get to the 50%, the CDC is so confident in Americans that they've actually put it on the chart, even though we don't yet know which state will win the competition to see who can have the highest obesity saturation in the country. But we've got some people down here in the South that are working really, really hard to achieve that goal. The fact is that 93% of all the calories that are consumed by people living in industrialized countries now come from either animal food or highly processed pleasure-trapped chemicals, so oil, salt, sugar, highly processed, hyper-concentrated food. 7% of calories come from fruits and vegetables, but 1/3 of that is potatoes, and those are mostly served as French fries and potato chips. So fruits and vegetables no longer make a statistically significant percentage of the diet of many Americans living in industrialized countries. The consequence of this obesity and the visceral fat and the inflammation that's associated with the visceral fat is that we have certain conditions that are killing people. The leading contributing causes of death in the United States are heart disease, cancer, and stroke. And we spend billions of dollars treating the consequences of heart disease, cancer, and stroke. But what we're not doing is addressing the actual causes of death, the reason people get heart disease, cancer, and stroke, which is smoking cigarettes, drinking alcohol, and eating a diet made up of highly refined carbohydrates and animal foods. Perhaps if we spent more time on the actual causes of death, we wouldn't have as many of the leading causes of death. So the things that kill most of the people that are dying in the United States, as I said, are heart disease, cancer, accidental deaths, chronic lower respiratory problems, and cerebral vascular accidents, Alzheimer's disease, diabetes, influenza, kidney disease, and suicide. And with the exception of accidents and suicide, the other conditions are all intimately associated with dietary excess. So what we're doing about it as a society is having people eat health food, olive oil and red wine, dark chocolate, coffee, coconut, diet sodas, and, Atkins paleo type diets, high protein, high fat diets. And what we should do, in my opinion, is instead of eating health food, we should focus on healthy foods. Healthy foods are fruits and vegetables, grains, legumes, nuts, and seeds, a whole plant food, SOS-free diet. SOS, of course, is the international symbol of danger, but it stands for the chemicals added to food, salt, oil, and sugar. So what's the answer? Well, the answer is diet, sleep, and exercise. Eat an exclusively whole plant food diet free from added salt, oil, and sugar. Get enough rest so you can wake spontaneously feeling refreshed. And get exercise and movement. We also recommend that people consider limiting their feeding window to 8 to 12 hours a day so that you're not eating 3 to 4 hours before you go to sleep. A health-promoting diet would include fruits and vegetables, grains, legumes, nuts, and seeds. Whole plant food, SOS-free. So modern humans have been around about 100,000 years. And in that time, for 99,800 of those years, this is the kind of food that people largely ate. And then about 200 years ago, the Industrial Revolution came along, and we changed the diet to something that looks more like this. Now, I want you to look very, very carefully and tell me if you can notice any differences. Because if you can notice the differences between the diet we ate for 99,800 years and the diet we've been eating for the last 200 years, you will have the mystery solved about why we keep getting fatter and sicker by the day. It's what we put in our mouth that's determining what's going on to our waist and hips. So I've said that it's difficult to escape the pleasure trap, but it's not impossible. And one of the very powerful tools that turns out to be helpful at helping people escape the pleasure trap is fasting. We have a new book, it'll be out in June. It's called Can Fasting Save Your Life? And it discusses everything about fasting in terms of the research that's been done by us and others, procedures necessary to carry out fasting safely and effectively, and what the outcomes of fasting have been and can be. There's a number of different types of fasting available today. Here's a chart that lists many of them, including time-restricted eating and alternate day fasting and some fasting mimicking diets of various sorts. But what I'm going to be speaking about today is water-only fasting, where water only is consumed up to 40 days in a controlled setting under supervision. And we do that at the True North Health Center, where prolonged water-only fasting is kind of what we do. It's the complete abstinence of all substances except water in an environment of complete rest. It turns out that resting is an important part of fasting because excess activity during fasting will increase the breakdown of protein through a process called gluconeogenesis. So in order to maximize fat loss and minimize lean tissue loss, rest is an important consideration. There are many mechanisms by which fasting is thought to be helpful to people. The most obvious is obviously weight loss. People lose an average of 1 pound a day in fasting. And as we'll discuss a little bit later, that weight is preferentially focused on fat, and in particular, visceral fat, the type of fat that has the tumor-like effect of promoting inflammation. People also go through natriuresis in fasting. This is the selective elimination of excess sodium that accumulates in people's bodies because they're eating salty foods. That salt forces the body to retain fluid in order to neutralize the toxic effect of excess sodium. And so the excess salt causes lots of problems like high blood pressure and congestive heart failure, non-healing wounds, osteoporosis, and other problems. In fasting, the body selectively mobilizes that material and eliminates it. And along with this excess salt coming out is also the excess water that goes along with it. So blood pressures drop, respiratory function improves, cardiac function improves, non-healing wounds start to heal. and even changes in taste neuroadaptation. So the cravings that get set up, the drug-like cravings that people have for excess sodium are mitigated, and the taste of whole natural foods becomes more desirable. Human beings living in modern society are actually quite toxic. That is, if you do a fat biopsy, you would find hundreds of different chemicals accumulating inside the cells of people, PCBs, dioxin, pesticide residues, heavy metals, intermediary products of metabolism, all kinds of nasty stuff. And during fasting, the body rapidly mobilizes and eliminates those materials more efficiently than it does even in the feeding state. And part of that detoxification process is involving enzyme systems. Enzymatic induction happens during fasting, where those enzyme systems are induced and actually persist. So you're better at detoxing, not just during fasting, but in the subsequent days and weeks after fasting, you're still detoxifying faster. And in fact, fasting is cumulative. So every time you fast, whether it's the intermittent fasting that you do on a daily basis or the occasional longer fast you do under supervision, those systems of detoxification are thought to be enhanced, improved, and increased over time. Enzyme systems are also used for mobilizing macronutrients like fat and glycogen and protein. And just like a trained athlete gets more and more efficient at mobilizing glycogen stores, people that are fasting periodically get more and more efficient at mobilizing those macronutrient stores, as well as the detoxifying systems. Fasting also reduces insulin resistance. Most of our type 2 diabetics are able to see significant improvement in the long run with insulin resistance and diabetic controls. Most type 2 diabetics are able to eventually achieve normal blood sugar levels without the use of medications. During fasting, and as a consequence of fasting, insulin initially goes down, but then HOMO-IR insulin resistance goes up during the initial refeeding as an adaptation coming back out of fasting. And then when you follow people much later, you notice there's a significant reduction below baseline. But it's very important to understand that insulin resistance is actually slightly higher as you come off a fast. So why it's so important that appropriate refeeding after the fast be introduced. Probably one of the most important parts of fasting is that initial refeeding. That's why at True North Health Center, we have patients stay at least half the length of the fast for recovery feeding, so that can be done in a controlled, effective, and safe manner. Too rapid a return to feeding after fasting can be very dangerous, particularly on long-term fasting, can result in serious consequences like post-fasting edema or refeeding syndrome, which ultimately could be damaging or fatal. Another mechanism by which fasting is thought to be helpful is alterations in the gut leakage and gut microbiome issues. The microbiome has been recognized to be a critical part of human health. You have maybe as much as 5 pounds of creatures living in your intestinal tract. These are living creatures, bacteria, protozoa, et cetera, that are intimately involved in balancing each other out and helping you immunologically, as well as producing necessary nutrients like vitamin K, et cetera. Alterations in the gut microbiome sometimes occur when people use antibiotic therapy or they're eating a diet that's high in sugar and animal foods. People, for example, on meat-based diets have completely different organisms than people on plant-based diets. And the people that are eating sugars and processed foods, the waste products of their bacteria is different than people eating whole natural foods. So when you think about 5 pounds of creature, 1 trillion creatures swimming around in your gut, eating, swimming, and defecating, you got to remember that what they poo in you is depending on what you feed them. So it's very important if you want to have a healthy microbiome, which is composed of, it's thought to be over 1,000 different strain of organisms. And you want them pooing fertilizer in you like vitamin K instead of toxic waste like TMA, which becomes trimethylamine oxidase and is thought to contribute to heart disease and other problems. You want to make sure what you're feeding your organisms are a whole plant food SOS-free diet. The autonomic nervous system is the part of the nervous system that controls all the things you don't think about. For example, if you went out and ran very hard, but your heart didn't speed up to pump more blood, you would die. But people don't die because they forget to tell their heart to speed up, because the heart speeds up automatically. And what makes the heart speed up automatically is the autonomic nervous system, which controls all the things you don't think about, including vasodilation, and includes bowel function and movement, micturition, et cetera, and controlled by this part of the automatic or autonomic nervous system. Well, when that autonomic nervous system gets out of balance, for example, if you have hypersympathetic tonia where the sympathetic tone is set too high, you can begin having symptoms like, for example, constipation. Or if the parasympathetic tone was set too high, you might have symptoms like diarrhea. Well, imbalances of the autonomic nervous system cause pain and debility, and we've got hundreds of different healing systems designed to try to correct those imbalances. That's how these different natural healing systems often affect our symptoms, whether it's chiropractic or osteopathic manipulation, massage, biofeedback, homeopathy. So many of these natural therapies work by trying to balance out the autonomic nervous system. Relaxation techniques, meditation, massage, etc. Some work better than others, but overall, that's the mechanism by which many of them are able to help alleviate some of the symptoms that they're used for. Well, in my experience, the most effective way of rebooting the autonomic nervous system is fasting. Fasting works like rebooting the hard drive in a computer. It will often, hey, you shut the computer off, you don't know why, but now when you turn it back on, it's working better. Well, same thing seems to happen with fasting. You shut everything down with fasting, you reboot with a healthy diet, and now a lot of these imbalances seem to be resolving. It is interesting that the Jews and the Jains and the Hindus and the Muslims and the Christians don't all agree on everything. But they do agree on one thing, and they all have a tradition about fasting. And it's probably because when you fast, it changes the way you relate to yourself and the world around you. You can't help but have an impact in how you feel and how you think. The immune system, we talked about part of the immune system was the gut microbiome, but other parts of the immune system involve various organisms that are designed to help with leukocytosis and neutrophil phagocytosis, et cetera. These organisms help kill off cancer and bacteria and help promote and preserve health. An important part of that is autophagy or autophagy, self-eating. The Nobel Prize in Medicine, in fact, 2016 was won by Yoshinori Ishimi, who did work on autophagy. And it turns out that one of the ways you can dramatically increase autophagy is fasting. Fasting dramatically affects this process, which may be why we're seeing the results we're seeing clinically with fasting and diseases, and infections and cancer, et cetera. Fasting also profoundly affects taste neuroadaptation. Taste neuroadaptation reflects the fact that your taste can change. If you're eating a greasy, fatty, slimy, dead, decaying flesh, highly processed food diet, you will crave those foods as you become addicted to that cycle, and you will lose your interest and enjoyment of less calorically dense foods like fruits and vegetables. Well, in fasting, we've actually done a study showing that there's a change in minimal sensitivity to the perception of sweet and salt, and the hedonic response to food changes. Good foods start to taste good after fasting. And as I said, fasting is very similar to rebooting the hard drive in a computer. It's really helpful at kind of getting us set back to our default settings. They say that nothing tastes as good as healthy feels, and I think that there's some truth to that. Fasting decreases some things too. It doesn't just increase things. One of the things it increases is glucose and insulin. So people with elevated glucose, or even people that don't have elevated glucose, will find their blood sugar levels dropping as the body converts to burning beta hydroxybutyric acid in the brain and converts to using ketone bodies rather than glucose as the principal fuel. Insulin growth factor 1 will reduce with fasting, and simply the lower your IGF-1, the longer you're likely to live. Leptin also goes down with fasting, and the lower your leptin levels are associated with reduced inflammation. Inflammation, it turns out, is a fundamental part of many of these diseases of dietary excess. Fasting lowers blood pressure and heart rate, and it reduces mTOR, which is mammalian target of rapamycin. And the lower your mTOR, the more your autophagy. That may be how fasting increases autophagy, is because of its effect on mTOR. Fasting reduces the microbial load and allows for rebooting of the gut microbiome. So after fasting, if you go on a whole plant food diet, high in soluble fiber, you'll start growing back the normal flora that should be populating your gut in deference to the abnormal flora that's grown because of the consequence of drugs, animal food intake, and highly processed hyperconcentrated foods. Fasting also decreases inflammatory markers like IL-6 and TNF-alpha and all kinds of markers they've begun to identify associated with inflammation. The whole range of acute phase reactive proteins tends to go down with fasting. Fasting reduces inflammation and oxidation, and it reduces the abnormalities associated with metabolic syndrome. Metabolic syndrome is essentially the epidemic that you see all around you, where people have elevated abdominal fat and blood lipids and glucose and blood pressure. And this metabolic syndrome is really the big epidemic in modern society. And every one of those mechanisms associated with metabolic syndrome tends to be benefited, often profoundly, during fasting. Fasting increases adenopectin and ghrelin, and that improves insulin sensitivity and reduced inflammation. Fasting increases AMPK, activated protein kinase, which downregulates something else called PGC1 alpha, which is peroxisome proliferator activator receptor. And that ultimately results in increased mitochondrial biogenesis. That's the mitochondria, the actual energy production components in the cell. And that may be why we're seeing the changes we are in chronic fatigue and some related syndromes. The actual mitochondria itself appear to go through biogenesis during fasting. Fasting increases BHB, which is beta-hydroxybutyrate. That stimulates the production of what's called BDNF. And BDNF is brain-derived neurotrophic factor, which stimulates nerve growth and helps protect the brain cells from oxidative damage. That's why, for example, rats that have higher levels of BDNF, because they're given a wheel where they can exercise, tend not to get Alzheimer's disease or dementia. So in addition to exercise, fasting also is associated with increased BDNF, the brain-derived neurotrophic factor that's thought to protect your brain from oxidative damage. Fasting increases insulin sensitivity, so insulin begins to work better. And it is also associated with an increase in cellular stress resistance and cellular stress adaptation. This recognizes the fact that cancer cells, for example, don't do as well in a ketogenic environment because they have higher metabolic rates than normal cells. And so when you go into a ketogenic diet associated with fasting, the cancer cells are more vulnerable to the body's immune responses, or for that matter, to chemotherapy. And they're protected against some of the damaging effects of chemotherapy, which is why they're now using fasting, at least intermittent fasting, as a mitigating factor to reduce some of the damage from conventional medical treatment. And where some patients, for example, patients who've been treating with lymphoma, have been able to successfully resolve their lymphoma without actually having to undergo chemotherapy or radiation. As I mentioned, autophagy is enhanced with fasting, and gut microbiome diversity, as well as the stimulation of B-cell immunity, occurs with fasting. Fasting, according to Walter Longo, published in Journal of Metabolism, combination of fasting with chemotherapy results in dramatically higher cancer-free survival than chemotherapy alone, because of these impacts, presumably on cellular stress adaptation and cellular stress resistance. So the question then is, okay, so fasting is going to help you lose fat, and preferentially visceral fat. It's going to reduce your inflammation. It's going to help you deal with all of these diseases. Is it actually safe? Is it safe to fast? We're fasting people as long as 40 days on water only. So to answer that question requires a study, what's called a fasting safety study, which we did complete. It was published in BMC Medicine, Biomedical Central, in 2016, it looks like, 2018, excuse me. And we described all adverse events that occurred over a 5-year period that happened in a total of 768 people undergoing medically supervised water-only fasting. These patients were all assessed every day, every symptom, and every symptom was assigned to the common terminology criteria for adverse events. So anybody that had any adverse event symptoms was categorized each of those symptoms every day. And the way those systems work is you have category 5, 4, 3, 2, and 1. Category 5, most obvious, easiest to track, that's death. So if you die, you get a category 5. Obviously, you only get one category 5 event because once you die, it's over. Category 4 events would be what would be considered serious events, something that would require intervention. Category 3 would be significant events, not something that's life-threatening or require hospitalization, but that could become a problem if it wasn't addressed. Category 2 are moderate events, local or non-invasive intervention, and category 1 are mild events. These are mild symptoms, clinical or diagnostic observations don't require any type of observation. And during the fast, in experience of these people, there were 768 patients who experienced 5,961 adverse events. Now, 63% of those were mild, headache, backache, skin rash, things you expect to see in fasting. 28% were moderate, so maybe dizziness or nausea or headache. 9% were significant. Most of these were hypertensive crises. You might ask, well, why would people have a hypertensive crisis defined as having a systolic blood pressure over 160? Why would people have a hypertensive crisis fasting if we're using fasting to treat hypertension? And here's how it works. Let's say you come in and your blood pressure is 220 over 120 and you're capped out on medications. And the next day your blood pressure is down to 200, then 190, then 180, then 160. Every one of those is an adverse event. So even though you're clearly getting better, it's trending positively because this is not related to causality. It's an arbitrary standard. Anytime a systolic blood pressure measures over 160, it's classified as an adverse event. And in fact, the vast majority of these category 3 events are people whose blood pressure is coming down or somebody whose blood pressure might have jumped up for a day as they come off medications and then enter into fasting. There were only 0.1% category 5. This is actually example here was low sodium hyponatremia. This patient's sodium went too low. It was easily dealt with. You just terminate the fast. But if you weren't monitoring, obviously that could have become a very serious issue. And then, as I said, there were no category 5 events. So common adverse events, things that happen in fasting, all the mild and moderate symptoms that, a large percentage of people have are listed here. Fatigue, irritability, muscle ache, changes in blood values, including liver enzymes and other signs of detoxification. People may have some biliary diarrhea, so they dump a bunch of bile from their fatty liver. They may have nausea. They may have dry mouth. They may have, in some cases, vomiting or certainly dry skin, palpitations, etc. So lots of symptoms. Fasting can be an intense and sometimes miserable experience, but if you prepare properly for it, which we'll discuss later, you can really minimize the intensity of some of these symptoms that people are likely to experience. More serious adverse events include alterations in electrocardiogram. Fortunately, because we can monitor these things, we don't let them become health compromising. We monitor people's pulse rhythms and electrocardiographs and auscultate their chests and do the things it takes so that these more significant symptoms will be identified, including alterations of elevated potassium or too low of blood sodium or blood glucose, etc. Relative contraindications to fasting include pregnancy or lactation. If you're pregnant, lactating, you probably don't want to be fasting, as you would lose your milk production. That would not be good for a child. If you have anorexia nervosa, you may want to fast, but fasting is not going to necessarily deal with your issue. Type 1 diabetics don't make insulin. You need insulin in order to be able to fast. So type 2 diabetics, which is the more common cause of association of diabetes, do very well. Type 1 diabetics would be having to do a modified program because without insulin, fasting would become problematic. If you've had a recent stroke, myocardial infarction, pulmonary embolism, or DVT, you have cardiac instability or atrial fibrillation, you may be on anticoagulant therapy. You don't fast on anticoagulant therapy because the drugs can become greatly potentiated during fasting. And you don't just arbitrarily discontinue them because it can be associated with a stroke. So we would have to first get people healthy, wean them off their medications, stabilize them, and then fasting could be considered, or maybe do modified fasting that wouldn't require the elimination of all medication. If you have severe kidney disease and your creatinine levels over 2.0, we wouldn't recommend water fasting because the kidneys are the main detoxifying organ of the body. When the body purifies the blood and eliminates the waste products, that's called urine. And so if your kidney function is too limited and you put the extra load on it from water-only fasting, you could compromise kidney function, and that would be a problem. If you have certain genetic defects like MCAD or porphyria, MCAD is medium chain acetocoenzyme A dehydrogenase deficiency, which means you can't break down fatty acids and you can't fast because you'd start vomiting and then you'd die. So we don't fast people with MCAD because it would definitely mess up our safety data. If you have deficiency, depletion, or cachexia, fasting may not be for you because if you've already in a depleted state, we'd have to build you up first before you'd be able to undergo certainly long-term fasting. If you can't discontinue medications, then you may have to do modified fasting because you do not want to fast on medication, with the rare exceptions of some true replacement therapies like thyroid therapy. If you can't rest, you shouldn't fast. If you're too active, you'll lose more weight, but it won't be fat. It'll be muscle. And so we don't want to be breaking down your lean tissue. We want to preferentially burn fat, and that means when you're fasting, you're resting. Conditions that are favorable to fasting are obviously the conditions associated with dietary excess: obesity and visceral fat, elevated blood lipids, elevated blood pressure, cardiovascular disease, type 2 diabetes, conditions like lymphoma, which is a type of lymph cancer, gastrointestinal imbalances, microbiome disturbances, autoimmune disorders where the body's actually attacking itself, like, rheumatoid arthritis, ulcerative colitis, ankylosing spondylitis, lupus, asthma, eczema, psoriasis. These conditions are all associated with problems of gut leakage. And during fasting, the gut has a chance to heal. Then going on a low oxidative damage type diet, so low risk of oxidative damage, prevents these conditions from activating. So you don't cure those conditions, you manage them. The truth is you don't cure any conditions, including obesity. You can lose the weight, you can keep it off. But if you go back to eating the greasy, fatty, slimy processed food that got it there, it's coming back. So you can manage it. You don't cure it. Dependence, toxicity, fatigue, and pain are all responsive to fasting. In fact, some dependence issues are fasting. Most smokers by the end of the second day will not report any physical cravings. Now, sometimes they say, yeah, they're so miserable with the fasting, they don't think about the cigarettes. But the fact is, the metabolic processes are just sped up, so it makes it a lot easier to get off those addictions and break those bad habits. Fasting duration ranges from 2 to 40 days. Average fasting length is 1 to 3 weeks. Some patients do require multiple fasts. We don't yet have reliable non-invasive diagnostic markers that tell us who should fast and how long, but we're working on it. That's part of the work that the True North Health Foundation is doing. Our 501c3 nonprofit research facility is trying to discover how to do this better, how to do it safer, and how to identify people that are the best candidates for this type of intervention. So I mentioned lymphoma. Fasting appears to be an effective tool in the management of lymphoma. Our first published case was in the British Medical Journal Case Reports. This was published in 2015. This case involved a 42-year-old woman with stage 3A grade 1 follicular lymphoma. It had been established by, excisional biopsy. She'd been tracked for 2 years. The condition continued to progress until eventually she was told that her only choice was to go through chemotherapy. But instead of doing that, she came to True North Health, underwent 21 days of water-only fasting, during which time her tumors disappeared and became non-palpable. After 10 days of refeeding, She was sent back for a follow-up evaluation with her oncologist. She continued to track with her oncologist. And after a year, we managed to publish a paper that did appear in BMJ. And then 3 years later, we tracked this patient, and she continued to eat a whole plant food SOS-free diet. And we were able to demonstrate that she was cancer-free, and then published that paper in British Medical Journal as a follow-up. And at 3 years, she was CT PET scans demonstrated that she was completely cancer-free. Now, this patient reported that she had maintained her yearly follow-up with her oncology appointments. She included her serology and computed tomography, and confirmed that she continued her remission. And she also confirmed that she continued to follow the diet. Now, I explained to this patient that she had to stick to the whole plant food diet or it could be fatal, because I would track her down and kill her. And apparently she believed me, because we just got her 10-year follow-up and she continues to be free of cancer. Now, since then, we've managed to put together a number of patients that we've been tracking with lymphoma. This case involved a 49-year-old male who had previously achieved remission with radiation therapy, but then had, as often happens, recurrence. He was diagnosed grade 3 follicular lymphoma of the head and neck. He had surveillance CT PET scans and identified several hypermetabolic mesenteric nodes. And so he underwent 21 days of fasting, during which time he experienced significant improvement, as demonstrated 3 months later on a CT PET scan. There was no evidence of hypermetabolic malignancy or new disease. We followed him and continues to do well. Another case, this gentleman, 56-year-old male, stage 3, grade 2 follicular lymphoma, underwent 21 days of fasting and demonstrated some initial improvement. And so then we brought him back, and when we brought him back, we underwent 39 days of water-only fasting. This was 10 months after the initial 21-day fast. And we're able to demonstrate additional improvements. 5 months after the second fast, revealed that the mesenteric lymph nodes had reduced in size, the inguinal lymph nodes were undetectable, and it also revealed a new finding of multifocal osseous intake in the left iliac crest, which was of some concern. But we brought him back for another fast 14 months later after the second fast, and the CT revealed mesenteric finding as well as decreased ossea uptake. So even that previously new problem was resolving. So we have the initial scan 2 months after the initial fast, 5 months after the second fast, and then 14 months after the second fast. And this series of cases that we're tracking has been put together in a case series. It's been accepted for publication in a peer-reviewed journal. It'll be coming out in the coming weeks. And for those of you that are interested, we have the foundation has a site, fasting.org, where all of our research is published. It's freely available. You can go in and take a look at all these and other studies that I won't have time to overview today. This was a case of seborrheic keratosis. These were lesions that showed up on a woman's face. And you can see here's an example of one of these facial lesions. A lot of people don't like having lesions like this on their face. In this particular case, the patient did some preparatory feeding, and then we did 11 days of water-only fasting and then some recovery time. And then during the time we were refeeding, the lesion started to disintegrate. And you can see the before and after. And this wasn't we didn't do any procedures. This was just the body's immune system activating and resolving this non-cancerous lesion. Paper that we published, this is medically supervised water-only fasting, followed by a whole plant food diet and its effect on visceral fat. So we were particularly interested, we had a DEXA scanner, we were particularly interested in identifying what's happening to body weight during fasting, because people often say, well, you lose weight, but you gain it back. Well, what we discovered is that that's not exactly the case. This were fasts ranging from 14 to 20 days with some refeeding time. And you can see here that the changes in total weight and fat mass, the body weight goes down and then recovers, but the fat loss continues. Lean mass goes up and then it's reduced as the body recovers. This next graph may be a little bit easier to understand. This is an example of a gentleman who lost total weight loss, 12%, total body loss, 18%, but total visceral fat loss, 55%. So almost 20% of the entire fat on the body was eliminated during this 2-week fast, but 55% of the entire visceral fat load was eliminated, only losing 4% of lean tissue. And more importantly, we know that 6 weeks after fasting, that lean tissue not only is recovered, but it's actually, the body has a higher percentage lean tissue at 6-week follow-up than it did proportionally at baseline. So you get all your muscle back, you continue to lose fat. So yes, body weight goes down during fasting, it comes up after fasting, but the weight you gain after fasting is water, fiber, glycogen, and protein, not fat. The fat loss continues even as the weight loss goes up. This paper, a preliminary observational study of potential effects of prolonged water-only fasting on whole plant food refeeding in normal weight females. So the next thing we wanted to do, we wanted to know what happens to healthy people that are metabolically healthy, have normal blood pressure, normal blood glucose, and normal lipids. What happens to them when they fast? And so we went about recruiting metabolically healthy people, but we found that was actually quite difficult because it turns out only 12% of the population are metabolically healthy now. 88% of people are no longer healthy. Sometimes they're not necessarily overweight, but they're still not metabolically healthy because they have altered blood pressure, they have altered lipids. We found it so difficult, in fact, recruiting healthy people that we ultimately had to resort to recruiting staff members at the True North Health Center because it turns out they were healthy. They live and eat at True North Health, and apparently it helps a lot because when we started testing them, they were able to pass the test. And so many of our subjects turned out to be our own staff. And you can see here, these are the baseline characteristics. Their BMI was normal, their blood pressure was normal, their blood glucose was normal. But what was fascinating was after fasting, so this was normal weight people, they fasted 5 to 14 days, average was 10 days. They refed for an average of 5 days, and then we followed them up 6 weeks later. And here's what we found. Their baseline weight improved even more and sustained even more. 6 weeks was down at 116 from 124. So they lost an average of 8 pounds. And these are people, remember, that are starting off normal weight. So body weight at 6 weeks was down. BMI was obviously down. Abdominal circumference was down. They lost 3.1 inches around their waist. Systolic blood pressure, which was 110 on average, was down at 106. So it improved even further. And for every point in systolic blood pressure drops, there's thought to be a 1% reduction in all-cause mortality. So even when your blood pressure is normal, it's even better to go down a little more. Diastolic blood pressure, cholesterol levels, which were normal, were even healthier, as was blood glucose levels. So, excuse me. So you see baseline total fat mass. They weren't fat, but they were even healthier afterwards. Total lean mass that had dropped during fasting had recovered by the end, even by the end of refeeding. As a percentage of overall lean mass, their lean mass ends up higher eventually. But remember, because they've lost weight, there's less of them in total. Okay. This was another case that we published. this was total resolution of hydronephrosis and urotectasis and partial regression of unspecified retroperitoneal mass. This was a 66-year-old woman who had adopted a vegan diet but was still overweight. She had been diagnosed with this unspecified retroperitoneal mass. They weren't sure if it was a fibrotic mass or a cancer. And so they said what they would need to do is go in there and do a biopsy, but it was kind of tricky because of where it was located. She also had a hydronephrosis and ureterectasis and kidney cysts. So she had alterations in her kidney issues. This was the CT scan that showed a 4 by 3 by 4 by 3 centimeter mass that they were proposing to biopsy. They couldn't get her in for a month to do the biopsy. So in that month, what we did instead was we put her on a 13-day water-only fast, had 11 days of refeeding time, and then we followed up 18 days later. Well, it turns out that during the fast, that mass reduced so much there was nothing left to biopsy, so they had to cancel the procedure. Her body weight went from 232 to 217, resulting in 14 pounds weight loss. BMI went down from being high risk class 3 to moderate risk class 2 on a single fast. Her blood pressure dropped from 164 to 124, a 40-point drop in blood pressure. And this is the mass before, and this is the lack of the mass afterwards. It was much, much smaller, not large enough to biopsy. This is another case. This was long-term relief from chronic post-traumatic headache after water-only fasting and an exclusively plant food diet. So this was a dentist who had undergone a traumatic brain injury. She got hit in the head with a pole and had had constant daily head pain for 16 years. Every moment of every day, constant daily headache. Underwent 41 days of water-only fasting, followed by 20 days of refeeding, during which time the daily headaches were dramatically lower in intensity, including having completely pain-free periods, but wasn't completely resolved. And so after 6 months of refeeding, we brought her back and did a second 40-day water-only fast, followed by 20 days of refeeding, during which time headaches were no longer an issue. Here's a chart that shows fast 1, fast 2, fast 3. And at the end of 5 years, she has no longer headache issues. BMI is sustained at 22, down from originally 33. Systolic blood pressure sustained at 106/67. So she not only got well, but she was able to stay well. And actually now we have 10-year follow-up data. She continues to do very well. This case was water-only fasting, followed by an exclusively plant food diet in the management of severe plaque psoriasis. Psoriasis is a really disturbing condition for a lot of people because it's visible on the skin. It's an autoimmune condition where it's the body's immune system that's creating this problem. This particular gentleman had had long-standing problems, 28-year history of severe, what's called plaque psoriasis. And he decided to undergo 13 days of water-only fasting. So slightly less than 2 weeks. This was his skin before we treated him. That's called plaque psoriasis. This was after just a couple of weeks of fasting, and this was 2 months later on follow-up. And process, obviously quite a bit of difference in a short period of time. Prolonged water-only fasting is a safe and effective treatment for managing type 1 and type 2 hypertension. This was a study we did with our colleagues from the Mayo Clinic. We recognize that hypertension is a huge problem. It affects half of the US adults. It's associated with $131 billion annually. That uncontrolled hypertension is one of the leading contributing causes of death and disability. And the risk of developing cardiovascular disease due to hypertension doubles for every 20/10 point of blood pressure increase. So this is a very serious problem, and that is true for blood pressure anywhere over 115/75. So even, quote, normal blood pressures of 125 or 120/80 still put you at increased risk for premature death and disability. In this trial, we investigated the safety and feasibility using the same standards we used in the previous study that I showed you, using the same Chronic criteria for adverse events from the American Cancer Society. This enrolled 29 people prospectively. So unlike the other, which was a retrospective analysis of data, this was a prospective. So people were went through informed consent. They were enrolled in this study. 29 patients, 19 female, 10 male, average age 62. Most of them were still on hypertensive medications as we started the study. They hadn't been able to be weaned previous to the study. Just as a reference, high blood pressure has two components, the systolic and the diastolic. The systolic is the top number. It represents the blood in the vessels when the heart contracts, and diastolic, or the bottom number, represents the blood in the vessels when the heart relaxes. And there's two stages. Stage one, if your blood pressure is 130/80, if either number is, then you're stage 1 hypertensive. If your top number is 140 or 90 or greater, then you're stage 2. So these participants underwent pre-feeding. Fasting ranged from 7 to 40 days, with the average fast, median fast being 11 days. Refeeding, average feeding was 5 days. Then we brought these patients back at 6 weeks and evaluated how successful they were at maintaining their weight loss and their blood pressure and blood-free state. And then we tracked people down at a year to see if they were able to sustain it. So you can see that most of these patients, when we started, were stage 2, 140 or 90 over Grady or greater, and some were somewhat less. We used the same classification that we talked about before. There were no category 5 or category 4 events, and there were hundreds of, as expected, of the mild and moderate symptoms. These category 3 events were all hypertensive, and none of them lasted more than a day, and they were all in patients, obviously, that already had hypertension, because that's why they were coming in. Okay. So this is the median BMI, which is a calculation of height and weight. And you can see their BMIs dropped. You can see their median body weight went from 190 to 177. And this is on follow-up. So keep in mind, they go from 190 to 174 at the end of the fast. They regain water, fiber, protein, and then at 6-week follow-up, they were actually lower. So they were losing additional weight. And then at 1 year follow-up, they had maintained that for a year on average. And in fact, when we look at the blood pressure, we find a similar story, that we look at the baseline, we look at the 6-week follow-up, and then we look at 12-month follow-up. And the people that they had dropped from stage 2 hypertension down to stage 1 were able to maintain those improvements even 12 months later. This chart may help you. Median systolic blood pressure starts at 142, ends up at 12 months later, 127. Granted, not as low as it was when they left the center. So there was a little bit of recurrence. And part of what happens is, I know you're going to find this shocking, but not everybody is 100% compliant when it comes to diet and lifestyle change. If we'd gotten 100% compliance, we would have expected we would have had stability or even additional improvements. But nonetheless, they're starting 142. A year later, they're down at 127. Here they're on medications, here they're not. This is the median diastolic pressure. Interestingly enough, diastolic pressure, which represents more of the large arteries, they start off at 81, they end up at 73 12 months later, even lower than they ended the fast, which I think is really impressive. And then if we look at antihypertensive medication use, most of them are medicated. At 6-week follow-up, only one person was on medication, and that was 1/2 dosage. So 14 of the 15 medicated people were unmedicated at 6 weeks. And then when we tracked people down at 1 year, there had been a little bit of recurrence in 6 of the patients that had to go back on some level of medication, but the rest of them had been able to maintain not only normal pressure, but a drug-free state. And so this is the median abdominal circumference. Again, notice that the abdominal circumference at 1 year on average is lower than it was even when we ended the fast. Median systolic blood pressure, median body weight, and median abdominal circumference. These are the average drops at 6 weeks. We also looked at treatment accessibility. adherence screener. In other words, this is a way of determining how acceptable is the diet and lifestyle ranges to patients. And it really didn't change at the end of the fast or the end of refeeding. And in fact, on 12-month follow-up, you'll notice the food acceptability questionnaire, could they like the food? Baseline was 47, 6 weeks was 47, end of refeeding 48, 12-month. There really was no change. So they didn't get tired of eating the food. They were still able to enjoy their meals at a similar level to they were at baseline. This is a scale that looked at, were they able to complete the treatment? Most of them were. Was I able to adhere to the requirements of the treatment? Yeah, people did fine with the treatment. Did they find it distressing? Not so much. People didn't find it particularly distressing. The treatment was effective as a way to treat hypertension, overwhelming agreement with that. And also, would they recommend the treatment to others? So overwhelmingly, people were satisfied with this treatment. We had one dropout, although dropouts sometimes have nothing to do with satisfaction. It has to do with life circumstance. Some, kids get sick, things happen. This is a dot plot. You'll notice that even though there's only a few outliers, those few actually have a profound effect on the averages because it's a small study with only 29 people. So we didn't have too many outliers here, but the ones we had didn't help the averages. But nonetheless, it's pretty amazing, the response that we demonstrated in this first prospective study. Relief of symptoms associated with long COVID after prolonged water-only fasting. So it turns out that we have been getting large numbers of calls from people suffering from long COVID and from COVID vaccine injury. So these are patients that either had COVID and never recover, they have persistent symptoms, or they didn't have anything, but they got usually multiple vaccines, boosters, and then they've developed symptoms that they're not recovering from. So vaccine injured and long COVID patients. And we've published our first paper, will be coming out in Integrative and Complementary Therapies. This is a 73-year-old male who arrived at the True North Health Center after a history when he was infected with COVID in 2019. He had chest pain, diarrhea, cough, gas, brain fog, lightheadedness, elevated temperatures, sore throat, and it had gone on for 6 weeks. 3 to 4 months later, he developed sinus congestion, post-exertional malaise, cognitive impairment, and that had persisted for 2 years, those symptoms. So when we saw him, we brought him in for fasting. This is his weight before fasting, after fasting, and after refeed, BMI, the blood pressure, as you can see. His fatigue intensity was severe before fasting, was mild after refeeding. His fatigue frequency was always and was just occasionally after fasting. Brain fog went from severe to none. And the brain fog frequency was rarely. He reported that he continued eating the SOS-free diet and all symptoms remained stable except for the brain fog and fatigue, which reportedly worsened from mild to moderate between 6 and 12 weeks after departing from the residential fasting center. So 9 months later, after his first visit, he developed another acute infection, which was confirmed to be SARS-CoV-2 infection by antigen testing. During the second infection, he reported splitting headaches, deep fatigue, but the symptoms were milder in comparison to the first illness. He did not experience post-exertional malaise, sinus congestion, loss of taste or smell, or any worsening of his existing fatigue and brain fog symptoms after fasting. And so we did a second fast. This was 15 months later for 10 days. And we did a follow-up 6 months later. And here are the results of that second fast. And then after refeeding, you can see his weight was now 134. BMI and blood pressure were the best they'd ever been. Fatigue was mild, frequency sometimes, brain fog was none, and brain frequency was never. And then follow-up 6 months later, you can see he'd regained his weight, which was good because he was underweight by the time we were done. His BMI was back in a healthy range. He had very mild fatigue and only occasionally, and had no brain fog or intensity. So he went from very severe symptoms to very mild residual with a couple of fasts, one of 14 days, one of 10 days. Now, that fasting duration was fairly short, but that was because he was a thin guy. He was actually, thinner. And so obviously when you're thin, you can't fast quite as long as you would if you're bigger. This study was an exclusively plant-based diet for polypharmacy due to persistent atrial fibrillation, ischemic cardiomyopathy, hyperlipidemia, and hypertension in an octogenarian. What that means is it's an 82-year-old guy who had problems with his lipids, his heart. He was in atrial fibrillation. He had high blood pressure. And he came into us on a pile of pills. He had memory loss and cognitive impairment to the point where they thought he was suffering from Alzheimer's disease. What we did is we carefully weaned him off his medications and fed him an exclusively whole plant food diet, and then got him moving around a little bit. And this is what happened. This is when he first came in, and this is when he discharged. We've got blood pressure from hypertensive to normal blood pressure. Weight about the same because he wasn't overweight. Cholesterol from 188 to 129. Triglycerides from 68 to 82. HDL lower. LDL dramatically lower. Patient adopted a treatment plan consisting of an exclusively plant food diet, and he recovered. Medications prior to starting, only thing left was this medication, which would have been discontinued, but you have to wait 12 months from the MI. So what was most remarkable is that he woke up. It turns out he didn't have dementia at all. He had polypharmacy. He was getting cognitive impairment secondary to his drugs, and once we got him off his drugs, he became completely alert. What was fascinating was one of the reviewers' comments at the journal saying, what a remarkable case report this was, but what made us think it might be the drugs? Prolonged water-only fasting in the management of Hashimoto's thyroiditis. This is the most common cause of hypothyroidism. Hashimoto's thyroiditis is essentially your body's immune system attacking your thyroid, an autoimmune disease. And the reason why the body attacks the thyroid may be similar to the reason why the body attacks the gut in celiac disease. In gut, gluten exposure causes the immune system to attack the gut. If you don't eliminate gluten, it can become life-threatening, serious problems. Well, in Hashimoto's thyroiditis, instead of the immune system attacking the gut, like in celiac disease, it appears to attack the thyroid gland and cause Hashimoto's thyroiditis. Interestingly enough, the HLA-DQ gene that's associated with Hashimoto's thyroiditis is the same gene associated with gluten sensitivity. So the theory is that it's the sensitivity to gluten that stimulates the immune system to attack the thyroid gland. In this case, though, you can see what happened. We have a 61-year-old female diagnosed with Hashimoto's thyroiditis 10 years prior. So she's had it for 10 years after experiencing, the weight gain, the edema, the joint pain, the fatigue, the constipation, the cold sensitivity, the brain fog, and the depression that are characteristic of this disease. She was given 120 milligrams of Armour Thyroid and continued experiencing everything except the constipation. We fasted her for 21 days, followed by 10 days refeeding. Patient reported decreased fatigue, joint pain, brain fog, and depression. She contracted SARS-CoV-13 3 weeks later, returned to the standard American diet, regained 15 pounds, and all previous hypertension systems returned. Came back for a second fast. This was 7 months later, underwent 22 days of fasting, 12 days of vegetable juice, 10 days of water only, followed by 10 days of refeeding, during which time experienced these changes. Now look at this. TSH, thyroid stimulating hormone, went from 61 down to 9.7. And CRP, C-reactive protein, a measure of inflammation, 13.4 down to 1.2. Armour Thyroid dosage actually was dropped from 120 down to 90. After the second fast, all previously reported symptoms resolved except for mild fatigue and intermittent cold sensitivity. Okay, so fasting is a really interesting process because a wide variety of conditions respond well to fasting. It appears that mostly the conditions that are aggravated or caused by dietary excess seem to be the conditions that respond the best and the most, but we're just beginning to really get the depth and diversity of conditions that will respond to this very interesting intervention. The research that we're doing, all of these studies that I'm citing here are done by the True North Health Foundation at the True North Health Center and are all published in peer-reviewed journals. All of them will be available on our website, truenorthhealth.com, or if you're just interested in looking at fasting research, you can go to fasting.org, where there's actually a tool on there where you can actually search the fasting literature. This particular paper, I want to mention as well, this was exclusively whole plant food diet in Fuchs endothelial corneal dystrophy. This is a condition that's normally treated by corneal transplant. This person presented with let me go back to the previous slide. There we go. This person presented with legal blindness and was able, over a period of dietary change alone, we didn't even do fasting with this patient, just doing the whole plant food SOS-free diet, was able to restore her vision, did very well. This was also a case, this was the non-pharmacological management of subacute appendicitis. So this was a gentleman who was told he needed surgery for subacute appendicitis, underwent fasting for less than 2 weeks and was able to resolve it, and years later was able to sustain his health. So we talked earlier about fasting and autophagy, fasting activating cellular stress response pathways and inducing autophagy. You know, this may be part of the mechanism explaining how so many of these diverse problems are able to resolve. Again, we're still trying to figure out, you know, exactly how all this works. Unfortunately, right now, the True North Health Center is one of the few facilities in the world that's doing research on long-term water-only fasting. There's a lot of work being done on intermittent fasting and fasting mimicking issues, not as much on the long-term fasting. What I'd like to do now, since we do have a little bit of time left, is go ahead and try to open up the floor for questions. I know that there's been a lot of questions that people undoubtedly have.
Sorry about that. So, how you doing, Dr. Goldhammer? We're now going to
Doing
begin
great.
our Q&A session. So, give me one split second here. Okay, so so before we begin the Q&A session, just want to let everyone know that if you'd like to ask any questions, you can raise your hand in the in Zoom, and you can go ahead. John, I think if you can put the instructions in there how to do so. All right, and so real quickly, one of the things I've heard of people who've done fasting is when they, and I know how important it is to, you know, the feeding processes when you come out. Some people that I've spoken to and I've heard have issues with overeating after they come out, right? They become like insatiably hungry. Is that something that you've seen as an issue?
Well,
and how do you?
Yeah, normally in a controlled setting, it's not a problem because we make sure people refeed properly. What happens in an uncontrolled setting is people will eat sometimes foods they shouldn't be eating, which stimulate an insulin response, and then your blood sugar drops down, your brain thinks you're dying, now you get cravings and binging, and it's a big problem. That's why it's so important that a refeeding protocol be followed. We do a day of broth and juices for every week of fasting, a day of raw fruit and vegetables for every week of fasting, then we introduce steamed vegetables and then starchy vegetables. But if you don't go through progressive refeeding, you run the risk of running into refeeding syndromes and post-fasting edema, cravings, binges, problems. You don't want to do that. If you're going to fast, you need to do it right.
Okay, thank you. And you mentioned in your book that fasting can be a tool to combat chronic diseases like diabetes. How does fasting impact insulin sensitivity and glucose regulation over time?
Yeah. So we talk a lot about this in the new book, Can Fasting Save Your Life, about the fact that initially during fasting, insulin drops, blood sugars drop, but initially after refeeding, HOMO-IR is actually slightly elevated as an adaptation back to the feeding state. And it's not until a few weeks after fasting that you see the big reduction in HOMO-IR. And you do see that improvement, but you have to be very careful during that initial refeeding phase so as you don't activate problems because of that. There's a cycling back into normal physiology after fasting. So, we're just learning about how insulin resistance actually works. And although fasting can be a very useful tool in resolving it, post-fasting refeeding is absolutely critical.
Can you explain the role of the SOS diet in maintaining health post-fasting as recommended in your
Yeah,
book?
well, the chemicals that make people fat, that create the insulin resistance and the visceral fat, are the salt, oil, and sugar. These are not food. Salt, oil, and sugar are hyper-concentrated food byproducts. They're added to food to stimulate dopamine production in our brain. And although they make food taste good, what tasting good means is it means it results in more dopamine stimulation. It's a drug-like effect. So people become addicted to the artificial stimulation of dopamine, whether it be cocaine, alcohol, caffeine, or nicotine, or salt, oil, and sugar. These work these same kind of pathways. And so we have to get rid of the salt, oil, and sugar if you want to get rid of the obesity. The reason why treating overweight is so poor is because we don't get rid of the reason that you're addicted to the problem. If you treated alcoholism by telling people to drink beer and wine, you wouldn't have very good outcomes. And if you're treating people that are overweight by allowing them to still have oil or still have salt or still have sugar, you're not going to have good outcomes. And the data supports that. Better success treating heroin than treating overweight. Because at least with heroin, they tell people to stop using the heroin.
That makes sense. I once heard it said 100% is easy, 99% is hard. So when you're trying to quit
Well,
something.
it is sometimes a lot easier just to stop doing the things. You don't tell your alcoholics, well, what you should do is become a bartender and just drink on the weekend and you'll be fine. We tell alcoholics what? Stop drinking alcohol. Now, people say, well, some people can drink alcohol and not be a drunk. Yeah, some people can. But if you're a drunk, it's not you. And some people can have some cheese or chocolate and not become overweight. But if you're overweight, it's not you. If you could have controlled it, you would have controlled it. So stop lying to yourself. Get rid of the SOS and then see what it feels like to be healthy. If you don't like being lean and healthy, you can go back to eating like everybody else is. They're not going to stop making that stuff because you stop eating it.
Good point. So in the context of candida overgrowth and its associated cognitive symptoms such as brain fog, could you share holistic strategies for effective management and eradication of this condition and discuss the role of dietary changes, the inclusion of probiotics, lifestyle adjustments, and any other pertinent therapies in enhancing overall well-being and mental clarity?
Well, sure. Candida is a normal yeast form that overgrows when the immune system is suppressed, usually associated with gut leakage and high sugar intakes and all the rest of the immunosuppressive habits that people engage in. So what you have to do to resolve chronic candidiasis is get healthy. So that means we do fasting first, we get rid of the gut leakage, detoxify the person, adopt a whole plant food SOS-free diet so that we're not constantly feeding abnormal microbial growth in the system, and then get really radical and get people to get enough rest because it turns out sleep deprivation is immunosuppressive. Engage in enough but not too much activity and try to minimize stress. People are under constant stress, and constant stress results in stress hormones. And when you do it constantly, it can be immunosuppressive. So it'd be nice to maybe focus on just worrying about the things you can do something about and stop bathing ourselves in the stress of, watching the news every day and having to be involved in all the worst possible things that could be going on anywhere in the planet constantly. You don't need to be constantly immersed in that material in order to be an informed citizen. You don't have to, bathe in it. So what we're trying to do is get people to reduce their stress, increase their activity, get the sleep that they need, eat a whole plant food SOS-free diet. And then if that's not enough to resolve the problem, consider long-term medically supervised water-only fasting and then go back and doing exactly the same thing. I have to say, though, because the center runs a couple months behind, so oftentimes we're working with people through our telemedicine before they can come in.
Mhm.
Many of our patients are getting well before we even get to see them, just by diligently applying diet, sleep, exercise. Applying these principles in preparation for fasting often resolves the problem that necessitated them to have to come into fast to begin with.
So now you've fasted, and I've seen this number for a while, so I'm sure it's way past there. Over 20,000 patients, and
Well, we figure we now have 25,000 people that have undergone fasting at True North Health in the last 40 years.
wow. So what do you see afterwards as far as do they maintain the healthier diet that you helped them with afterwards? What percentage of people actually maintain the health benefits? And
Right.
and then of the
So,
people who fall off, what are the challenges that you think
sure.
have been the cause of that?
So I shared during the talk a study where we actually have hard data on 1 year follow-up data showing that 75% of the people that were able to maintain weight loss and blood pressure free, normal blood pressure drug-free state. So at least in those highly motivated people, a majority were able to sustain it at least for a year. We're doing some long-term plans to do long-term study now. We'll carry people for multiple years. But the general feeling is if somebody can sustain behavioral change for a year, they've done a pretty good job. It's now within their realm of adherence. So the problem is only highly motivated patients are successful. And there's two kinds of patients we see that are highly motivated. People that are driven by pain, debility, and fear of death, or people that are health conscious and willing to do anything in order to sustain health conscious because they want to live a healthy life and they want to have a healthy death. They want to live their life until they reach their genetic potential, go to bed one night and not wake up, rather than spend the last 20 years of their life unable to talk or move, lying in some nursing home bed, waiting for people to come and change their diaper because they've had a stroke or a heart attack and can no longer remain autonomous. And so both people driven by pain and debility or people really driven because they don't want to have debility, those seem to be the people that we treat the most at the True North Health Center, and they both tend to do very well.
Great. And how do personalized fasting dietary protocols at the True North Health Center take into account individual genetics and lifestyle factors?
Well, every fast is an individual situation. So we never know exactly how long a person's going to need to fast. In fact, we're really flexible at True North. People can stay as long or as short as they want. There's never any cost or penalty because they get done early. So we just guess long and let the body determine how long they're able to fast. And oftentimes you're just waiting until the problem resolves. If a person has high blood pressure, we want to have normal blood pressure. So we'll fast them until their blood pressure is normal without medication. If they have diabetes, we want to wait until we fast them long enough to get their blood sugar levels normal. If they have pain, we want the pain to go away. I mean, sometimes it's not rocket science. But on the other hand, what we do really well is we make sure people don't go too long. And we're monitoring people so that we don't go from fasting into starvation. If you go into starvation, then you deplete your vital reserves and then you die. And that would be really bad for our outcome data. So we don't do that. And we've not done that really effectively for 40 years because everybody that's walked in has walked out. When you think about the 25,000 people we've treated, many of which are seriously ill, and the fact that everybody that's managed to walk in has managed to walk out means we're doing a pretty good job of monitoring those patients. Because some of those people, just by number of patient day years you have, you would expect to have some, fatal outcomes. And we don't because, fasting itself is a biological adaptation. It's a safe process when it's done according to protocol. And we always do it according to protocol.
Thank you. So now you mentioned COVID in your presentation. What are you seeing now with regard to the after effects of the pandemic? Are you seeing a lot of people coming in with long COVID, issues with the vaccine, anything like that?
Yeah, we have significant numbers in fact, we have one of the cases I mentioned in the talk today was a long COVID publication where we were able to get resolution with the use of fast. It took a couple fasts. Some of them are really difficult cases. And we're also seeing a number, particularly healthcare workers. We get a lot of healthcare workers referred, I think partly because they're in high stress jobs, but also because they're getting multiple boosters. They're mandated by their employer to get these multiple boosters, and people that have underlying autoimmune diseases and other problems sometimes manifest associated problems. And those people are coming in and so far seem to be doing well with fasting. We're just now publishing our first case, our first long COVID case. With these cases, you not only have to get them well, but then you have to show that they've stayed well. They want to have follow-up data. And so it takes a while from the time we see them to where we can get the papers published in peer-reviewed journals.
And for that population, what are the symptoms that you're seeing?
We have the whole variety of long COVID symptoms, from brain fog, fatigue, the disruptions, the joint pain, the GI symptoms. There's just a whole host of symptoms. You think about all the stuff that shows up with autoimmune disease, and you can pretty well mirror it. And those conditions, fortunately, are responding. The things people are most disturbed by sometimes are the brain fog, the mental cognitive issues, and the pain issues.
And you've been able to effectively treat that with the fasting?
Yeah, so far the people we've been seeing. Now, again, you got to remember, we get highly motivated people. These are often, with the long COVID, many of them have been health professionals. They're very knowledgeable. They know what to do. They were doing fine until they got their fourth booster or whatever, and then everything blew up. And so I don't know if you can generalize this approach to the population as a whole. People that are not willing to eat well, not willing to sleep well, not willing to exercise are probably not going to do well just with fasting alone. I think fasting has to be used in conjunction with healthful living if you're going to expect to get these long-term results. If you just fast and then go back to the greasy, fatty, slimy, dead, decaying flesh diet, I wouldn't expect to see sustained results. There's nothing magic about fasting. It just seems to let the body do this process much quicker.
How do you measure and evaluate the success of a fasting protocol? Are there specific biomarkers or health indicators that you prioritize as you measure that?
Yeah, in fact, we've been expanding our list of biomarkers, these acute phase reactive proteins, and looking at some of these genetic markers. There's all kinds of interesting biology and physiological parameters that are available to us. We recently had brought in a DEXA scanner so we could do whole body composition. We've been looking at a number of these biomarkers that will be appearing. In fact, some of the articles we have coming out look at adenopectin and look at methylhistidine and different ways of measuring what's going on in the body. And so for people that are interested in that, they should just check out our website, and where we publish those papers, all of that data will be shared and released.
So in the context of autoimmune diseases, which you mentioned, how does fasting initiate an immune reset, and what evidence supports this claim?
A big part of it, I think, is probably going to turn out to be the healing the gut leakage. You get rid of the gut leakage by reducing the acute phase reactive proteins, the inflammation associated with that. Then you get rid of the oxidative damage by not eating the dairy products, the oil, the sugar, the animal products, so that inflammatory process can heal. And then you don't get the body attacking itself as much. And so that may be overly simplistic, but I think we'll find microbiome and gut leakage issues intimately involved in not only these patients recovering, but also what's happening in fasting. Again, the very first study that's ever been done on long-term fasting and the gut microbiome was done by us, along with our colleague Luigi Fontana from Washington University. And the very first paper in that series of paper has appeared recently in Lancet preprints. And that was on all these microbiome, that was on biomarker changes. The next paper that has not been published yet is on the microbiome changes, the actual changes in the microflora that occur as a consequence of fasting. But what we think is happening is that when you fast, there's a big die-off. And when you refeed on a proper diet, you get to regrow the organisms that are supposed to be there. And there's a big change both in what organisms are there and what waste products those organisms give off.
Thank you. So how does True North Health Center's approach differ from other fasting programs, and what makes water-only fasting uniquely effective according to your research?
Well, I think that there's mostly the fasting that's done is people like Valter Longo and others using intermittent fasting, which is, using like Prolon or other substances. They're getting some level of caloric intake. This is a process that can be done much more safely on an outpatient basis. You can do it. People can do it at home, that kind of thing. But it's going to have a different effect than it's a fasting mimicking approach. So they're trying to mimic some of the effects you get with fasting. There's not been good comparative studies yet about what happens, long-term fasting versus a number of intermittent fasts. We hope to do that. In fact, we've talked with Dr. Longo about, doing that exact study and doing some comparison with some of the much simpler intermittent fasting protocols. I have not seen any data being published by anybody that compares to what we're seeing with water-only fasting, though, in terms of prolonged water-only fasting, its impact on conditions like lymphoma and other things. I'm not seeing that data being reported. So, maybe it will turn out to be better or just as effective, but I haven't actually seen the data to support that yet.
Thank you. So how do raw seeds, nuts, avocados, and olives fit into the dietary recommendations you make post-feeding for optimal health maintenance?
Well, we don't use olives because they have to be associated with salt in order to make them palatable. Otherwise, they're kind of disgusting and people don't want to eat them. We do use nuts and seeds, raw nuts and seeds, but we do limit quantities. We talk about an ounce a day for most people as kind of an upper limit because it's easy to overeat those. One way to help prevent overeating of nuts is get them in the shell and then shell them. By the time you've shelled 6 walnuts, you're ready to move on with your day. It's the tendency to overeat is a lot less than when it's turned into nut butters or you're, eating these processed foods. But so we do use nuts and seeds and avocado because we're not actually advocating a very low fat diet. We're advocating a diet that's about 15 to 18% of calories from fat. So it has room for avocado, nuts, and seeds in the diet. And it eliminates some of the concerns about the very extremely low fat diets that sometimes you get when you don't use any kind of animal-based richer foods. But we do recommend for especially people that are under weight control issues, you don't want to just eat those foods with abandon, eat them with some respect. And so we recommend limiting the quantity of those foods just so that we don't get into, high fat, high caloric density diets.
So you just mentioned salt with regard to olives. So salt's often demonized in health discussions, and perhaps rightly so. Could you provide insight into why eliminating added salt is crucial for health, according to your research and your clinical?
Sure. Well, you get all the carbohydrate you need from whole plant foods. You don't have to add sugar to your diet. And you get all the essential fats you need. You don't have to add oil to the diet, including olive oil. And you get all the sodium you need too. You get a gram a day of sodium when you're eating large volumes of these mineral-rich fruits and vegetables. Now, granted, since most people, 93% of their calories have nothing to do with fruits and vegetables, they who knows what they're getting. But for people that are eating on a whole plant food SOS-free diet, they're getting the sodium they need from the diet. There are some exceptions. People that have hypoparathyroidism, if they don't produce mineralocorticoids, they may need to have a higher sodium intake in their diet, in which case we could use more sodium-rich foods. There's some foods like tomatoes and Swiss chard and celery and that are particularly rich in sodium. And so, if you incorporate a little bit more of those foods in the diet, or for those rare individuals that need a higher sodium intake, you can still usually avoid having to, quote, add salt to the diet. It's just that we know strong evidence suggests that 1,500 milligrams or less of sodium a day is associated with reduced risk of cardiovascular disease, particularly high blood pressure and other kinds of problems. Patients do better when they're on a lower salt diet. But more importantly, sodium has an effect called passive overeating. If you take an animal and give it whatever it is, brown rice, whatever, and eat till it's full, until it reaches satiety, it'll eat a certain amount. But if you salt that food up, everything else being equal, it will eat more before it feels satisfied. And so what people do is when they're eating highly salted foods, they will eat more than they would have eaten had they eaten foods without the added salt, and it contributes to obesity. So even though there's no calories in salt, it still is helping make people fat. If you just take the salt out of the diet, it makes a lot of the foods that they shouldn't be eating less of a problem and less palatable. For example, bread. People love bread, but it's got 1,500 calories a pound before you turn it into a butter boat by putting coagulated cow pus all over it and increase the caloric density even further. But if you take bread and take away the oil, salt, and sugar, what you end up with is called matzah, which is punishment on Passover, far less tendency to overeat it. So the point is the salt makes a lot of the foods more palatable. Meat, for example, boiled beef is disgusting, I'm told. But, it's the sauces, it's the gravies, it's the salt, the oil, the sugar, it's the marinade that makes the disgusting, dead, decaying flesh more palatable to people. And so you can't underestimate the effect that this salt is having in allowing us to eat foods that we shouldn't be eating in the first place.
So for individuals who can't get to visit True North Health Center, what guidelines do you suggest for safely conducting shorter fasts at home?
Sure. So the first thing is buy our book, Can Fasting Save Your Life? Because in it is everything you and your doctor needs to know to not screw it up. Second of all, if you're not going to go to a facility, you still have to follow the protocols, which is history, exam, and lab. And as your doctor still has to make sure you're a good candidate for fasting, you still have to rest during the fast, and you have to follow the fasting and the feeding protocols, which are clearly laid out in the book. And we have a telemedicine practice. We have doctors with experience in fasting that can help people coach them through those processes in conjunction with their local doctor that would be able to order the lab and and do what they need to do. So it is possible for some people to be able to do remote fasting safely. And we have a great service. We offer people, if they fill out the registration forms on our website at truenorthhealth.com, I'll review their medical history. We'll talk to them about, are they a good candidate, and point them in the right direction for no cost. There's no cost to talk to us for a screening call like that. And so that way they would know, one, should they do it? If they should do it, where can they do it? If they don't want to go to one of the facilities that do it, we can hook them up with a doctor that knows what they're doing and that can help work with their doctor. And this book is useful for them and their doctor because it has all the parameters laid out in there, what tests are done, what the meaning of those things are, what the concerns are. It's a really good, comprehensive book on can fasting save their life, and it helps them identify if they're a candidate for this type of intervention.
Thank you. So in the context of cardiovascular health, what specific improvements have you observed in patients following fasting and an SOS-free diet?
Well, we have the largest effect size that's ever been shown in treating human beings with fasting, an average effect size of over 60-point drop in systolic blood pressure and stage 3 hypertension. We had 174 people in a row who were able to lower their pressure enough to eliminate medication. And we just did the first prospective study where 28 of the 29 patients were able to completely eliminate medications at 6 weeks, and one was able to reduce to half dose, and showing that on the follow-up patients, 75% of people were able to sustain their blood pressure 1 year later. So, we've got good data suggesting that highly motivated people can normalize hypertension and eliminate the need for medication, and along with it, the side effects of chronic cough, fatigue, impotence, and premature death.
Thank you. So Dr. Michael Greger highlights autophagy's role in health, noting that excess nutrients can hinder this cellular cleanup process. With fasting and exercise as natural enhancers, considering this, how do you view the benefits and risks of different fasting methods like intermittent fasting, weekly one-day fasts, or annual extended fasts? How should we integrate fasting into our lifestyle beyond the 16-hour overnight fast to optimize health?
Well, we do think that, limiting overeating is the biggest thing. Get rid of the oxidative damage to begin with. That fasting, whether it's intermittent fasting or long-term fasting, may help accentuate the process. And clearly, it's not linear. You're going to see a geometric increase as you get deeper into the fast. We can see that clinically. You get more and more profound changes. If you go on a fast, if you go on a diet and lose 10% of your body weight, you may lose some of your tumor and other things. You go on a fast and lose 10% of your body weight, you don't lose 10% of your tumor. You may lose the whole tumor because the body's preferentially mobilizing these materials, and it does it more efficiently in fasting than in feeding. So healthy eating is the key to healthy living. Diet, sleep, and exercise. But fasting is a great facilitator. And for people trying to recover their health, there's no question that fasting has a role for many people.
Thank you. So I'm going to have the audience ask a few questions. So I'm going to start off with David R. David R., please state where you're from and state your question.
Hi, this is David from Massachusetts, and I have two quick questions. So first of all, regarding the salt, what are your thoughts about potassium chloride as a salt substitute? And the second question, can fasting reverse or improve soft blockage in the blood arteries? Thank you.
Okay, what was the second? I didn't quite get the last part of the second question.
The second, regarding fasting, is there any evidence that fasting can help improve or reverse blockage in arteries, in blood arteries, especially soft plaque?
Okay, so the first part of your question, I'm sorry.
Potassium chloride. Potassium chloride.
Yeah, so potassium chloride is a very good question. Potassium chloride is used as a salt substitute. Unfortunately, in studies that try to compare, does it work better than using salt? The answer is no, and it turns out the chloride itself has contributing factors to some of these difficulties. The reason I don't like it is you never neuroadapt to a low-salt diet if you keep using these salt substitutes. And what we want people to do is get to the point where they don't want the extra salt, that when they go out and eat soup at a restaurant, they don't even want it because it burns their mouth because they've neuroadapted a healthy diet. That happens after fasting. You eat chard and you think, oh my gosh, this is so salty. It's the same as it was before, but now you can actually detect it. So as long as you keep putting in these salt substitutes, you'll never really adapt to where you'll really enjoy a whole plant food diet. And if you don't enjoy a whole plant food diet, it's unlikely you're going to stick to it. Now, as far as reversing atherogenesis, Dean Ornish in Lancet 1980 published one of the first papers showing that coronary artery atherosclerosis could reverse. And, there's pictures there over 32 months, dietary change alone, reversing significant reversal of coronary artery disease. So that was kind of breakthrough stuff. And we believe that that happens even more quickly in fasting. The reason we believe that is because we see the effects clinically. Now, we don't have data to publish on that because we won't do coronary arteriograms in our patients because there's a small mortality consequence. We don't want any of our patients getting screwed up with our testing that's unnecessary. So we're glad that other people are doing that kind of testing, but we won't actually recommend it on our patients. Now, there's going to be other not less invasive procedures like MRI perfusion studies and stuff that we may be able to get involved with to kind of prove this, but we're satisfied ourselves clinically because, the angina, all the related symptoms reverse, the blood lipids reverse, clinically it reverses. We're pretty sure that if we can get in there and non-invasively evaluate coronary artery disease, we'll be able to show that it's reversing as you would expect, because part of the correlation is with how much visceral fat's being mobilized. So if you get the visceral fat off, some of that's coming out of the vessels. And we know that it reverses with diet. We suspect it reverses with fasting more quickly than diet. But regardless, as long as you're willing to do the diet as a consequence of the fasting, you're still going to get well, whether the fasting speeds it up or not.
So I just want to follow up on the question about potassium chloride. I actually asked Dr. Michael Greger about this last year, and you said something about it doesn't work better. What would working better mean? And
Well, in terms of treating blood pressure,
okay.
there wasn't a substantial improvement, at least in the papers that I saw, when they substituted potassium chloride for sodium chloride.
Oh, okay. So it wasn't the sodium then. You're saying so it may be the chloride.
It is the sodium, but there's other things besides the sodium, including the chloride itself, that you still have in potassium chloride that seems to have a detrimental effect. And also, part of the effect of the sodium may be the stimulation of the overeating, and potassium chloride may still have the stimulation of the passive overeating that the sodium chloride does. So it may not just be the sodium itself that's having the problem. You've got to be careful that association doesn't mean causation. And so just because higher sodium intake results in higher death rate doesn't necessarily mean it's the sodium, but it may be the consequence of the sodium. And the consequence of potassium chloride may be exactly the same as sodium chloride when it comes to overeating.
Well, thank you for that clarification. So next question is going to be thrown out to Joe W. Please state where you're from and ask your question.
This is Joe from Arizona. Thank you, doctor. Do you do colon cleansing enemas or colonics during your fast? And if not, why not?
So we do occasionally do some colon cleansing, but generally we try to avoid it. And 98 or 99% of the time we can avoid it by doing careful pre-feeding before the fast. If we can get people to eat properly before the fast, it becomes unnecessary. And it's detrimental in the fact that it stimulates the autonomic nervous system. It can leave bowels sluggish post-fasting. The stool is mostly autonomic nervous tone and bacteria. And so, if we feed properly before the fast, most people's bowels evacuate spontaneously. We don't have to intervene and do bowel laundry stuff. But there are exceptions, and there are some people that have particular problems with impaction issues or autonomic tone. And in those cases, we'll use a colonic or, if necessary, an enema or other type of intervention to make sure that we aren't going to have unnecessary problems.
Great. Thank you.
Thank you.
Keep in mind, though, that the bowels are not a principal source of detoxification. Everything in the bowel is stuff that never got in the body. The detoxification in fasting is not from the bowels. It's from the blood being purified by the kidneys and eliminated in the urine. We're much more concerned about the urine as a source of detoxification. That's why we emphasize hydration. We minimize 40 ounces of pure water a day. We monitor urine function and specific gravity, et cetera. So the bowels is basically bacteria, stercobilin, lineage, and a few undigested materials. It's really a secondary issue, and it's designed to have material in it constantly. Your bowels constantly being populated. So the idea that you're auto-absorbing from the bowels is a bit of a misnomer.
Okay, so the next question is going to be Regina. Regina H., please state where you're from and ask your question. Regina, can you hear me?
Oh, yes, I can now. Sorry. I'm from Frankfort, Kentucky. My question is, doctor, does fasting help with nerve I have undiagnosed nerve damage in my, I don't know if it's damage, but in my legs.
So you
So
mean
does
like the
it help
vessels in your
anything?
legs?
The nerves in my legs, yes.
Right. So fasting appears to have a positive effect on circulation throughout the body. In fact, we're interested in doing a study looking specifically at the vessels in the eyes that we also expect to be impacted by fasting. And there's a non-invasive way of measuring that, and we're hoping we can do a study. We haven't been using diagnostic ultrasound yet, so we haven't been doing like flow studies, which we would like to do. Once we get the $100,000 it costs to get the machine, we'll be able to start evaluating that. So there's so much stuff that we want to do that we haven't been able to do yet. We've had a particular agenda showing fasting safety, looking at the more acceptable interventions in coronary artery disease and diabetes, and then publishing case reports that are, outliers that people wouldn't normally think of. Some of these really fundamental issues like measuring flow and stuff, definitely need to be done. We just haven't quite gotten to it yet.
Okay, thank you.
What I can tell you, though, is patients coming in with intermittent claudication and the symptoms of vascular compromise have dramatic, consistent across the board improvement. It's really quite remarkable where they come in, they can't walk, and then by the time we're done fasting, they're able to go out and do prolonged walking. Clearly, clinically, the results are there. We just have to kind of get the objectives to prove it.
Thank you for that, doctor. So regarding mental health, your book suggests fasting can have positive effects. What mechanisms underlie these improvements?
So the two conditions that are most common in our society is anxiety and depression. And there's a really interesting little book out there called Anatomy of an Epidemic, which is written by a researcher that points out that the debility that comes from depression has dramatically increased since 1986, coincidentally around the time that Prozac was first introduced. We began treating depression with serotonin uptake inhibitors. What used to be 95% of the time would be self-limiting, now 60% of the time results in debility. So basically, we've started managing depression with serotonin uptake inhibitors, which damage the brain of human beings that take it. They deactivate T2 receptors, and when you try to stop taking the drugs, then you get anxiety and depression, and then you're told you have a biochemical defect, which does not exist, and that you have to be on these drugs the rest of your life. And so it's a really nasty little cycle that we've set up. What we do is we carefully help people wean off their antidepressant, anti-anxiety medications, fast them, reboot their system, and then help them work on their psychological stress issues. We do have people like Dr. Lyle who does behavioral cognitive therapy and can help people because, there's more than just diet involved here. There's also the stress issues. But the combination of that has been effective in a significant percentage of people that are able to normalize their depression and anxiety symptoms and eliminate the need for medication that goes along with managing them.
So from your experience, does taking the selective serotonin reuptake inhibitors over time damage the brain, and is that recoverable if it does damage the brain?
Well, it's really slow and it takes a long time to recover. And he talks a lot about that in that book, that it can take sometimes not just weeks or months, but even years to help undo the damage that's caused by long-term use of these medications.
Great, thank you. And in your experience, are there any conditions or patient profiles for which fasting is not recommended? Or should we
Oh, yeah, whole lot. I mean, we see a whole lot more people that are not good candidates than we are good candidates in terms of screening. The people that are good candidates, as we said, are the people that have conditions of dietary excess and willing to do dangerous and radical things like eat well, exercise, go to bed on time. And the people that are not good candidates are people that are looking for magic. They want to figure out how they can continue to engage in short-term pleasure-seeking, self-indulgent behavior, but not have to pay the price. That's not what we do as any use. We don't have any magic to offer. This is all about hard work. This is probably the most difficult thing you could ask a patient to do. Adopt a health-promoting diet and lifestyle in a society designed to make them fat, sick, and miserable. And everywhere they go, people are going to try to undermine their success. And the more successful they are, the more hassle they're going to get from people, because they're going to walk in the room and create cognitive dissonance in people around them just by their very success.
Thank you. So we have about 3 minutes left before we need to wrap up. So let me ask you not a quick question, but the relationship between fasting and cancer is a topic of interest. Can you discuss any research or case studies that?
Yeah, well, we talked about the lymphoma and the lymphoma series, and we've been tracking a number of patients now with lymphoma. Lymphoma, we're actively treating and publishing because the conventional treatment for lymphoma has serious limitations that even if you send it into remission, it tends to come back and blow up and be a mess. And so it's not considered unethical to, get people well. And so we're able to not only get people well, but publish those cases without running into the problems where it's different than the standard of treatment, which is sometimes delusionally thought to be effective. So in this particular type of cancer, we're not getting as much problems from offering people an alternative option because watchful waiting is oftentimes the course of care. And so we have the opportunity to actually help them get well. I think that there are cancers that are going to have much more difficult time treating. These solid organ cancers are not going to likely be as responsive as lymphoma appears to be. But, nonetheless, we're going to try to investigate as best we can within the limits of, what we're able to do and what we're able to publish. Because right now, it's not that easy doing it, but it's really not that easy, publishing about it. It's very difficult to get articles published in peer-reviewed journals just because there's so much prejudice against diet and lifestyle, let alone fasting. So we've been, I think, remarkably successful in that we have, I think, 18 or 19 papers now that have been published. And if you go to fasting.org, you can review all those sites. And I think we've done a good job, and I think we can do an even better job. And I'm hoping now that we've found some success, we'll be able to garner more interest from affiliates, people that are interested in doing collaborative research with us, and that we'll be able to be more successful in terms of fundraising and all the rest of it.
And if someone was generally healthy but wanted, and was dedicated to their health, would they be a candidate to go do maybe a shorter fast there or whatever an appropriate length fast?
I think the people that are going to turn out to get the most benefit of fasting are healthy people using it preventatively. And that's typically going to be the shorter 5, 7, 10-day fasts. And whether they do it at True North Health Center or they do it at home, I just want people to do it right. Make sure they're a good candidate by history exam and lab, make sure they rest when they fast, and make sure they recover properly. And if they're interested in understanding that, read our book, Can Fasting Save Your Life? And you'll understand if you're a candidate and what the protocols you and your doctor will have to go through to make sure you don't screw it up.
All right, great. And I think that concludes our time. Always a pleasure, Dr. Goldhammer. I really appreciate all the information that you shared today. So with that, if we could unmute the audience so they can say thanks.
2 hours.
Love you, Dr. Goldhammer.
Oh, I want to speak to that. Was amazing.
Blessings, everyone.
Thank you.
Blessings.
Because of the location that it is.
Gracias.
And